When patients have trauma, that's what causes the microlesions. Now there's 3 phases of healing. There's the inflammatory phase, and if there's no other aggravating factors, it starts to heal in 72 hours. Well, the therapeutic goal in the inflammation phase is to decrease pain, inflammation, muscle spasms. So chiropractors can have therapeutic protocols for that. Pain management can have therapeutic protocols for that, okay? No big deal. The second phase is the repair phase. This is where all the nasty stuff happens. There's 4 major negative things that happen in that repair phase that if they're not corrected with therapeutic protocol, you end up with a permanent injury and eventually the #1 disability in the United States. And this is what happens. 2 are neurological, 2 are connective tissue based. First thing that happens after trauma and these micro lesions, you have what's called regenerative nerves go in there. Your peripheral nerves regenerate. This is on microscopic levels. These nerves go in there, and they fire, the new regenerative nerves fire at a low threshold, not the original threshold. Now what does that mean to the patient if a nerve is going to fire quicker? Here's what it means to the patient. I'm going to use my patient, the one I shared with you that had normal range of motion, because it's classic. Remember, the soft tissue spinal injury patient has normal active range of motion. What do they have totally abnormal? Overpressure joint motion, and that's what causes this problem. So let me use my patient in this example. So could she move normally in active range of motion? Yes, the medical doctor said she could. I told the jury she could too, because she could. That was when they stopped and I didn't. But when she went over to pick up laundry or pick up her 6-year-old child, in other words, anything she had to do in the activities of daily living to bend over, in other words, go into overpressure. Well, what all activities include going into overpressure in your lower back? Does that include tying your shoes? Does that include getting dressed? Is it important to get dressed in this world? Does that include maybe washing your feet? How many activities of daily living are including in your being able to bend over into overpressure with no pain or discomfort? You get my point? A lot. She had not only a lot, but the one that was most emotional to the jury was she couldn't pick up her 6-year-old child. Okay? She couldn't do a lot of other things without pain. So why? Well, the nerves fired. When she bent over in overpressure, the nerves that used to fire here, they now fire here. So that's why that was one of 3 reasons she had pain when she bent over. Here's the second reason she had pain. The regenerative nerves that go in there, number 1, they're more sensitive, but also there's an increase in the number of nerves that go in there. It's called hyperinnervation reinnervation. And it's a normal healing process. Well, here's what happens. When you have, let's say you have an injured area. Let's use this area as the area of anatomy, whatever it is, okay? And before the injury, you had a certain number of nerves in here. And you could bend, move to, whatever. Now, after the injury, you have an increase in number of regenerative nerves. So there's more nerves per area. Well, if there's an increase in the number of nerves per area, and I compress that area, what's the likelihood of now compressing those nerves if there's an increase in the number of nerves? That's a second reason you'll have pain from hyperinnervation reinnervation. And when those nerves are compressed, when do they fire? The same or quicker? Quicker, because they have lower firing thresholds. That's why when she went into overpressure, those were 2 reasons she had pain when she bent over. The third reason she had pain is that collagen, that scar tissue goes in there. Well, it just lays in there randomly. When it lays in there randomly, those regenerative nerve fibers go in that matrix. They go into that matrix. And that matrix is like this. The scar tissue just randomly goes in like this. It's like patchwork. Well, that is not how we were born. We were born with type 1 collagen that's striated. And when it's striated, it makes the tissue stronger. But when it's not, and it goes in a matrix form, those regenerative nerves go in between that matrix. Well, when I move, that matrix starts collapsing on itself, starts contracting. Well, guess what happens? If I move just a little bit, no big deal, right? In other words, active range of motion. But guess what happens when I go into overpressure? Guess what happens to that matrix? Does it stay the same or does it pull tight? It pulls tight. Well, what's in the middle of this matrix now when it pulls tight when I go into overpressure? Those the increased number of nerves with higher firing capacity. Those are the three reasons people have pain and discomfort in overpressure post-injury permanently the rest of their life. There's probably people in here right now that have old injuries that if they did a certain motion, it would hurt from an old injury. That's why. I just explained the pain. Now let me explain the soft tissue part and how it affects the #1 disability in the United States. That matrix that goes in is only 70% as strong and it's only 70% as elastic. It's called type 3 collagen. We're born with type 1. Type 3 is weaker, cheaper tissue. That's what heals. That's the scar tissue. By the way, before I move forward, the last example I just gave you about the matrix and the nerves, that's the #1 reason for failed back surgery. That's the #1 reason for failed. Over 50% of back surgeries are failed surgeries. Over 50%. The #1 reason is the scar tissue, the regenerative nerves, getting tangled and stuck in the scar tissue matrix. And that's why the surgeons are trying to create smaller and smaller lesions. That's the #1 reason right there. Moving forward to the connective tissue. So now we're at the scar tissue. It's only 70% as strong. Here's why. If I had 10 pieces of thread and I laid them out in a matrix and I pulled, let's say I pulled at this angle. So I only had maybe one piece of thread here and then there's one here and here. In other words, they're all in different directions. And I pulled, in other words, I pulled a tensile strength. It would be very easy for me to pop that one thread. It'd be very weak. But if I took all 10 strands of thread and I put them in the same linear direction, the same amount of force wouldn't pop any of them. That's why your tissue is only 70% as strong post-injury. Now again, this is all if you have not had any therapeutic protocol to reverse or minimize these effects. Everything I'm talking about right now is what physical medicine, especially chiropractic, does to try to minimize and stop this from being much of a problem. But a lot of times we can help it, but not get it back, not prevent it from happening 100%. But that's what happens therapeutically. That's what we're trying to do as doctors. That's what our therapeutics are trying to stop this from happening. Okay, so the matrix is not as strong because it's not lined up. What does that mean to the patient? Well, if the patient can go from here to 90 degrees before the injury, now they try to go from here to 90 degrees after the injury, but it's only 70% as strong. So when they get to that overpressure motion, what happens to those threads, those fibers? They snap. What's that mean to the patient? Re-exacerbation, re-injury. That's the #1 reason for re-exacerbations and re-injury from old injuries. The tissue's not as strong, and the patient stresses it, and it can't hold up. The fourth negative aspect of healing is the collagen that goes in there is not elastic. That's why these injuries are permanent. When you have these micro lesions in the ligaments and the soft tissue, that's why they're permanent. They don't go back. They won't go back. It's not elastic. Once it's been stretched, that's it. There's no elastic in that type 3. Type 3 collagen doesn't have the elasticity. So once that you've measured that, that's it. What if that measurement is, 2.5 millimeters translation, it's going to be that or worse as time gets on. It is not coming back because there's no elasticity. It is not a rubber band. Those are the physical properties of type 3 collagen. And so what happens is the patients now, they try to do some of their activities of daily living that they could do before. Well, they don't have the elasticity. So they have normal range of motion. But what happens when they try to go into the overpressure range of motion or joint motion? Do they have the ability to do it now when they have type 3 collagen in those joints? No. They have stiffness. And when they heal permanently wrong that way, it causes altered joint motion. And so when you have a patient that has these soft tissue spinal injuries, altered intersegmental motion, alteration of motion segment integrity from these traumas, they heal wrong. That's why the patient has pain. Those are the 3 reasons they'll have pain and discomfort and overpressure with an activity of daily living. In the case of my patient, picking up laundry or a child besides tying their shoes, putting their socks on. And they'll be susceptible to re-injury because it's weaker. And it'll be stiffer. And because of that, you now have altered spinal biomechanics. Remember that book called Clinical Biomechanics of the Spine by Punjabi and White? This is explained in there. So when those bones move abnormally, no different than your tire, all 3 of your tires being in perfect alignment, but that one tire being out of alignment. And go ahead and drive 200 miles or 300 miles. It's going to cause pain. Those are the 3 reasons the patients get pain with activities of daily living. And remember, the 1-2 punch of personal injury is what? Impairment first, pain and restrictions with ADLs, things that are important to the patient. This is why it's based on the science of the 3 phases of healing and that trauma. And so this is why the patients have pain and discomfort and overpressure, restrictions and stiffness, altered spinal movement. Altered spinal movement creates premature wear and tear. That's what causes pain, discomfort, restrictions, and ultimately the #1 disability in the United States, osteoarthritis. So you're taking these soft tissue injuries and you're settling for low ball offers left and right. Not that you knew. You were in a state of unconscious incompetence. You didn't know you didn't have all 10 of these documented because you thought all doctors were the same like I thought all attorneys were the same. Now you know. Now you know there's a difference. And this is why the soft tissue spinal injury is so important. Is because it's the #1 leading cause to the #1 disability in the United States. And everything that I just told you is in every one of our narrative reports, in our depositions, and in trial. How do you like that narrative report? How do you like that deposition? How do you like that? Make sense?